The sleeve gastrectomy, or the laparoscopic sleeve gastrectomy, or gastric sleeve as it's also known, is presently the most popular weight loss operation in the UK, America, Europe, and around the world in general. It is an operation performed using the keyhole technique, so it's a general anaesthetic, 5 little cuts on the tummy, and the surgery itself takes around an hour. What's involved is that we go into the tummy, we place all our instruments, and we staple the stomach and remove around roughly 3/4 of the stomach and take it out of the body. So what's left behind is a small narrow tube of stomach, so that's called the sleeve, and that helps patients to reduce the portion size of food that they're able to eat and gives fantastic weight loss in the long term. The other part of the operation is removing the upper part of the stomach, also called the fundus, and that's the part which produces the ghrelin hunger hormones, and therefore as a result from the surgery, not only will patients have a reduction in the portion size that they're able to eat and they need to eat in order to feel full, but they'll also be feeling less hungry between meals, and that's one of the main effects of the operation which helps it work. The other effect of the sleeve is that it speeds the emptying of food through the stomach, and so because the food reaches the lower parts of the intestine quicker, that leads to release of really good hormones in the body such as PYY and GLP-1, and these hormones have additional metabolic effects to help boost the weight loss and help in some cases to improve obesity-related medical problems such as type 2 diabetes, heart disease, and lower the risks in the long term of having a heart attack and so on. So on average, we can expect patients to lose anything from an average of 25 to 30% of their total body weight over a period of 9 months to a year, and then after this the weight plateaus and the sleeve will act as the patient's tool to help them maintain the weight loss in the long term. It's considered a non-reversible procedure because we are removing a part of the stomach, and therefore this operation will help patients achieve long-term sustained weight loss, which is clearly one of the key benefits of weight loss surgery and why a lot of patients come to the clinics asking for help with their weight. As part of preparation for the sleeve gastrectomy, patients will often have a consultation with their surgeon, and then they'll be assessed by the Tonic team, so the dietitian, the psychotherapist, the bariatric nurse specialist, ahead of getting them ready for the surgery. In the couple of weeks leading up to the operation, patients will often be asked to do a specific liver shrinking diet, an 800 calorie a day diet, low carbohydrate, low fat, in order to reduce the size of the left side of the liver, which sits over the stomach, because the first part of the surgery involves lifting the left side of the liver in order to get to the area we're going to be operating. In terms of recovery from the sleeve, the operation itself takes around an hour, and often patients will be nursed afterwards on specialist bariatric wards that employ an enhanced recovery after surgery program. So they'll be up and walking within 3 hours of the surgery, drinking the same day, and home the next day. The recovery itself will normally take around a week, and in that period immediately after the operation, patients will often be on a specialized diet, so 2 weeks of liquids only, 1 to 2 weeks of a pureed blended diet, 1 to 2 weeks of soft, easy to chew foods, and then after this they'll start to eat normally. The first follow-up after the sleeve is roughly around 6 to 8 weeks after the operation, and that appointment will be arranged by the Tonic team. Surgeon will review the patient in the clinic and will advise regarding progress and weight loss, check the wounds, and ensure that no immediate problems with eating and confidence and so on have occurred after the surgery. Because patients will be living lifelong eating from a small side plate, and I recommend the use of portion control plates such as the one that Tonic provides, they will have to take additional multivitamin and nutrient supplements, so we'll often advise patients to stay on an all-in-one multivitamin supplement, and additionally patients will need to take for at least 2 years after surgery a vitamin D supplement, iron supplement, and have a B12 injection every 3 months from the GP to ensure that they're having enough nutrients on board during the period of rapid weight loss. The alternative to that is that there are a number of commercially available weight loss supplements, all-in-one supplements. So Tonic's equivalent is Vit My Life, and this is an all-in-one supplement that patients can take, and that avoids the need to have B12 injections through the GP. And as long as patients attend regular follow-up and comply with the instructions from the dietitian, the psychotherapist, all of the follow-up that the Tonic team will advise, and take their nutritional supplements supplements regularly afterwards, they're guaranteed almost to have a fantastic result from such a weight loss operation.